everybody. We're having a great mastermind already. We've already caught up on a few things, so I'm glad you could be with us tonight. We have a lot to talk about. We're pretty much 3 months post-COVID reopening, and we want to mastermind ideas and find out what we're doing, what's working, what's not working. The first thing that I want to address on the list is leading in a crisis. And so I asked some of you to share your wisdom. How do you lead in a crisis? So who would like to share? What are some tips and pointers about leading in a crisis? Dr. Watson, do you have something you'd like to share about that? Okay, it looks like Dr. Watson is frozen. All right. Dr. Allgood?
Sure, Paula. That, of course, as COVID has not been quite the crisis for me that it has been for others.
Right.
But there have been other times during my practice days where there were some crises. Hopefully that was a good use of the term. The AIDS crisis, the professor at the University of Georgia, sterilized, and we had to, God forbid, we had to sterilize our hand pieces, But, I think with a crisis, there are a couple of things you can do. One, you can throw your hands up and say, my God, what am I going to do? All right, that's one way to handle it, okay? That usually doesn't work too well. But the other thing is to determine what is going on. And actually, it's easy to say, okay, I'm the big leader in this crisis in my office. At the same time, if you don't get the other people in your practice involved, or in your private life, wherever the crisis is, and you try to just rule everything and make everything, what you say, you're not going to get that cooperation. And I think that may be one thing that's happening in our country today. So to lead in a crisis, you have to get others involved and know what's going on and helping you figure out how to get through this crisis, so that they actually have the ownership of the crisis and also how to handle it themselves. So
that's good.
That's basically it to me.
That's really good. That's really good. Thank you for sharing that. Kevin Devine, would you like to share something?
I kind of like Andy. I didn't have to be a leader so much in the crisis. I guess each of us is a leader in some way, but I think, sometimes in the crisis, it's almost easier to lead because people are looking up to you and looking for leadership. Half the battle sometimes is the herding of the cats and trying to get people to follow you when you're trying to lead. So I saw some good leadership in my partners and bosses during this crisis, and the big thing was nobody knew anything. So it was hard to lead, and I think the leadership was more just keeping your team together and keeping the team calm and knowing that they had your support.
That's good. That's really good. I like that. Anybody else like to share? Dr. Watson, I called on you, but I think your screen was frozen.
No, I didn't realize you had muted me.
Oh.
Yeah, I don't know. I think that leading into crisis is just like leading pretty much any other time. You just have to focus on one day at a time and make sure that everybody's informed, make sure that everybody's on the same page. Focus on your goals. And if you need, set new goals, just keep focused ahead, and you have to assume that everything is going to work out fine, and just be positive about it. And it's gone that way for us.
Yeah.
Everybody's on board, and I heard somebody say that right now we're working with the wind to our back because we've got so much to catch up on. What's going to happen a little bit later, we're all in the same boat, yeah. But we are working on that, and
It's good.
setting new goals. One thing that Paula and I did, it was really her idea. It was um, trying to find an incentive for filling in the hygiene openings,
Hmm.
and in October. And so we came up with a little game we have in our office, something we call our shopping spree, where every day, if we meet certain goals, we put a little money in the kitty, and at the end of the year, we all go shopping. We divide it all up, and everybody spends their money on themselves. So what we decided to do was every slot that we filled for October, we would put an extra $5 in the kitty. So we started out with 126 openings, and we're down to 99 now. So 99 is a lot, but it's not 126.
That's right. That's right. Every
Yeah.
every little bit counts.
Yeah.
That's
Yeah.
exciting. Thank you for sharing that.
Yeah.
That's been a real
Okay.
win for your team.
Paula,
Yes.
Paula, this is Dan.
Hey, hey, Dan.
How you doing? And when you talk about leadership,
You're breaking up. Sorry about that.
we missed you.
Now you're back.
I'll have to wait some. Are you still with me?
Yeah, you're back. You're back.
Yeah,
Go ahead.
I'm on the road a little bit. So, but again, leadership during this time when it was really bad, the best part was, like you and Eric and the group there and my Advantage partners, we would talk. We would talk all the time. So when you had, when you're trying to lead, it's easy to lead when you have other people.
And we lost you. There.
And we'll have to go to another caller.
Okay.
Kevin, please turn down your radio when you call in too, by the way.
If you lead in a crisis, you have to have a good cell phone.
Yeah, he's driving. He's in Maine. He's got two things against him right there as far as cell signals
There you go. There you go. I'm going to share my screen for a second. I wanted to share this with you. This is a momentum document from John Maxwell, and many of you know I'm a certified coach with John Maxwell. I love his trainings, and he had some pretty good things in here. I'll highlight a couple things. Momentum functions for a leader much like the wind and terrain do for a cyclist. So you can't really control the weather. I mean, we had no control over COVID. We didn't bring it. We can't necessarily make it go away. But I think focusing on the seeds, like Dr. Watson, you just shared about, we had 126 open mounts, 99, but hey, we're planting some seeds, right? Maybe the harvest isn't all there, but we've seen some really good things happening. I think keeping hope alive is really, really important. People get tense and emotions. I've had several. I told Michael at dinner, I said, I think about 75-80% of my coaching is team drama. There's just a lot of stuff going on, and we may not realize what it's coming from, but that's part of it. So fostering unity. I know you're not able to read all of this. I'm trying to go through it pretty quickly, but we have to manage the adversity and keep hope alive and continue to ask the team to work on unity. So those three things I thought were pretty good comments from John Maxwell on regaining momentum or leading in a crisis. Pretty good things. If you want that document, shoot me an email or a text and let me know, and I'll get that to you. But Eric, why don't you tell us about a V-shaped recovery? What in the heck is that?
Well, I was thinking about everything you're sharing, Paul, before we jump into it, but I will say this, that the offices that I've seen, I wouldn't say struggle, but are having challenges out of the box here, out the gate, just trying to get back to a normal schedule. A couple factors that I see. One is the bigger the practice, the more people, the harder the message is to create clarity through that. So, two, some team members didn't come back. and that created a bigger challenge. It was like trying to hire people while everybody's running in different directions. It was just, it's been crazy in that regard. And the unemployment situation, unemployment benefits haven't really helped that. And so it's added another layer of stress to what's going on. And then team members wondering, why haven't you hired someone, and not communicating about that. And so, and then in multiple locations, that also creates an issue when there's more than one location, kind of bigger. Again, you have the common theme that I keep seeing is you probably have to communicate more than you ever have before.
Yes.
Amen.
Excellent
And
point.
with what you shared from Maxwell, all those things, I still, in that, I see communication. And you can have really bad communication. You could be yelling and screaming, that could be communication. Or you can have really effective communication and clarity. I think too, we are so busy right now that our communication is suffering by taking shortcuts in our communication too. I'm seeing this with a lot of clients where we share a client in Connecticut, Paula, where I think there's like not enough communication going on. And if it is, I just want to send an email. They respond better to an email. I'm just like, you've got to sit down with your team and talk with them.
Yeah.
And so I just, right before this, I was doing a Zoom interview for a local office here that's hiring. And she was an office manager. She's willing to work part-time now, take a pay cut to get out of an office where there was so much drama and craziness post-COVID. I literally stumbled into a gold mine because she's way overqualified. She's going to move into second chair position part-time, and she ran a practice, a very successful practice, because the drama got out of hand for her. She just resigned. She didn't need the money. She's like, I don't need this. I don't need the stress of this. Mm-hmm. And so without communication, that stress seems insurmountable. Mm-hmm. And so if your team members don't see an end in sight in it, they don't know you're working on it, they can give up.
Yeah.
So in a V-shaped recovery, I think we're seeing, I don't know what shape this is. This is January and February, and this is April down here, and this is June and July. This is what I'm seeing, massive production and collections at a high rate, best month ever, because it's not really apples to apples. We're working 5 days a week, and I'm having to tell doctors, you got to pull it back now, because you're going to create a W. You're going to drop off a cliff here in a second because you're robbing October to pay August. And so at this point, it's don't worry about getting them in right now. It's time to fill those 96 openings in October. I don't want to work 5 days a week anymore. I did that for 8 or 9 weeks now. It's time to chill because the stress level gets too high and people don't like each other that much when they work that hard in dentistry. So I would say a V-shaped recovery is what we're in right now. It's been phenomenal. I'd say 90% or more of my clients have had just best months on their tracker, just phenomenal. I was a little surprised that we didn't collect more while we were closed in some locations. That surprised me. I figured we'd have 0 accounts receivable by the time we got back, and that just wasn't the case. And maybe that was, people weren't working. They didn't have the money to pay their dental bill. Maybe that's what it is.
I think some of that was the team was a little bit approval addicted of like, I don't want to ask people for money when they're laid off right now. Yeah.
Yep. They were making more money than when they were working, but we don't want to ask them for money. The unemployment rate was.
I have a friend who owns a car dealer. It's a personal auto locator service. He said he had his record months when those stimulus checks came out.
It was time to go be frivolous, I suppose, not pay your dental bill.
Yeah.
And the other frustrating part I think that we're coming out of this in is with dental insurance. And so I think I'm seeing more and more than ever, dentists ask me, is now a good time to get out of network? And normally I would say, Normally I'd say, absolutely, do not be a network. That's the worst decision you can. Why spend 40% on marketing when you can spend 3% on marketing? And the problem is, I don't know what October holds for your practice. I was just a couple of hours ago with a client in Canada. He's working 50-hour weeks, and he wants to know if he can cut back to 4 days a week. And honestly, looking at his production per hour, I said, no, you can't cut back until you change the way you schedule. You can't cut back your hours. Or maybe it's a chicken or the egg situation, but trying to explain to him, you got to get out of $300 per hour, $300 per patient. That's not going to pay the bills if you have goals. I said, so let's get through October, make sure there's no financial cliff for you, and then let's decide that in December. And I'd say the same goes for insurance. For those that are in network, trying to figure out, well, why am I paying so much these in-network fees when I don't have to? That's another situation that can create a cliff that you don't want to really go into right now. I think January 1st, you can start attacking that. So
This is
and
good.
I don't include Delta in that either. I would say Delta is something that we're not going to touch at this moment, but let's get through to January and then
Really
decide.
aggravating with the PPE, and they're saying, some states you're not allowed to charge the patient, and then
Yeah.
the insurance isn't going to raise their fees, and so let's open it up to you guys. You see the topics here, and let's ask you, first of all, is there anything you want to share with the group, a challenge you're having that's not on this list that we can help with, or is there something particular that you would like to discuss on this list of topics? We got recession, proof your practice, fall hygiene schedule, the PPP loan, the PPE equipment if you're having trouble with that, team morale, which we mentioned briefly, scheduling, patient perception, marketing, and then we have some other announcements there about some things Eric and I are doing. But what questions do you have? We want to hear from you.
So, Paula, we got an anonymous question from an Uncle Vern. And
Uncle Vern.
Uncle Vern sent an anonymous question here.
I know Uncle Vern. My favorite uncle.
No, he didn't send it. There's no anonymous question here, but Uncle Vern would send it anonymously, but sign it. I would add to that list HHS 2%. Should we go after that money too? I think that's a topic that we should discuss.
Yeah. There you go.
Uncle Vern gets a $20 bill. It's a prison now.
Right.
I got that 2% thing.
Yeah. So you got it qualified. What's the contract look like to sign afterwards? I know it says 90 days on it.
Yeah, I have not read the whole thing yet, which means I have not touched the money.
Yeah. And I understand you have 90 days, so I would set the money aside. At the end of the 90 days, if you haven't signed the contract to accept it, they withdraw. They take it back out of your account.
Yeah. So it's sitting there, and I haven't decided. It's a good chunk of money.
Yeah.
I think the biggest thing is that once you accept it, it's publicized.
Yeah.
Okay.
Yeah.
Yeah.
All right.
Yeah. I'm going to tell everybody anyway, Dave. So you might as well let the government put it out there. So I think the only thing I've heard negative, and you can tell me if you look at this from a dentist perspective on the contract, is reporting number of COVID patients seen. And I think that would be 0. Once a quarter, you're reporting 0. So that's the only thing that I've seen so far. Although if they had made all the decisions they were supposed to by August 17th before they left, Congress, I think we'd have more clarity on this. But you have till August 28th to apply. I would apply, get the money, and sit on it. You have 90 days to accept it once you get it. So that's my thought on it. But if you don't need the money, I totally get it, and maybe apply for it and then hire me and give me a raise, and then go that route.
Yeah, I've applied for it because I got plenty of uses for it. And my accountant, Kate Williford, said, go ahead and do it. The only thing that the caution is to set a little bit of it aside because it's going to be taxed probably unless they change it.
It's just like an insurance payment. Yep, you're right.
Yeah, we're going to set some of it aside. Yeah.
Good idea.
What's it called?
Dr.
Called
Johnson? The HHS one?
Yeah, HHS. It's a payment. It's not a grant. It's not a loan. It's just money from it comes from, I think it comes from United Healthcare, I think. So HHS. And then Paul and I sent out an email that has from a CPA firm that has the short form application. They've made the application much easier now to apply for. Mm-hmm. So if you need that, Dr. Johnson, let us know. We'll send
Can I ask a question?
Si, senor, paz.
So I wanted to know what money this is that you're discussing. I didn't catch that.
Well, because Kevin Devine is so loaded, he's decided that anybody in this group that needs 2% gets it. So what happened was they made a medical plan in the HEROES Act. They made a medical plan where they said frontline medical workers, we're going to give you 2% of your annual revenue from pick your best year, 17, 18, or 19. So these hospitals that are $5 million, $50 million hospitals, we're going to get 2% from the government, like Triple P, and that's going to come from an insurance company, a payment to you. But here's the catch. Anybody you see that's a COVID patient, you need to write off the patient portion. Basically, the government saying it's okay to do insurance fraud at this point because we're giving you 2% to cover that basis. Please don't ask people who are suffering for money. And who's a COVID patient? Everybody. That's what they defined as a COVID patient. So if you were in a hospital and you decided to take that money, yeah, you got your $100,000 or whatever it was, and then you decided not to take money from the patients and do a write-off. And so they'll have to report all that. The ADA went to battle and said, we want dentists to be involved in that too. They've had a lot of expenses with PPE, and they're seeing patients. They're in the healthcare industry, but we don't want them to be, they're not Medicare providers or whatever. We don't want them to have to write off that difference and become Medicare providers. And that somehow got approved, and dentists became exempt from having to write off the patient portion. And because you don't see COVID patients, there's not going to be much reporting. So here's 2%. So $20,000 to you on $1 million practice can help cover some of that equipment you bought. Our worry, our concern is, are there any loopholes in this? And we have until August 28th to apply. So there's your window. When you get the money, you have 90 days to sit on it. I had offices get it a week ago Monday, so they've had it for 8 or 9 days already. So $16,000 to $25,000 different practices. Practice got 40,000, and he's like, I'm just going to sit on it for 90 days and think about it and see if any surprises show up. If nothing, I'm going to sign the contract and keep the money.
Right. Good.
HHN. Yeah.
Good explanation, Eric. Thank you for buzzing that off.
I have no idea if
Thank you
anything I
very
said
much.
is correct. Yeah, I don't know if any of that's correct. That's just what I heard. So
But you're
I'm not a lawyer. Do not hold me to any of that.
we sent out some emails about this. It was really kind of hot in the topics maybe, 2 weeks ago, Eric?
Yeah, 2 to 3 weeks ago. Yeah, everybody was going, yes, get it. And then all of a sudden everybody pumped the brake and went, wait, we actually read the contract write-off Medicare. What? Stop. And then we realized dentists were exempt from that. The ADA didn't really make that clear. And so the assumption we're making from if we take the ADA's word, is that we're exempt from those write-off requirements and Medicare requirements. The only thing we're not exempt from is reporting COVID patients seen. As I understand, I haven't seen that. Dave probably will see it before any of us, I suppose, and he'll tell us what it looks like. But I'm guessing it's a zero reporting.
Yeah, I read through all of the terms and conditions. I have a large practice that got it, and yeah, it didn't say anything. It's been a while since I read through it. I read through every bit of it. And they may have changed some of that since then, because that was in the beginning.
Yeah.
So, all right. What other questions do you have? Anything about fall hygiene schedule? How's everybody doing with that? Who knows? Dr. Watson knows how many he's got open and how many to fill. Who else knows their number?
I don't have the number, but I've been looking at it daily. And there's quite a few. The old office is filling up fairly well because we've got a lot of people backlogged that we're moving into those dates. We're also pulling people forward from December, moving them into November and October.
Okay. That's
So
good.
we do have a lot. And we're also encouraging, because of being closed for a while, and a lot of our team take vacation in the fall. We're encouraging vacation for hygienists at that time, get those used up.
Right. Mm-hmm. You know, a couple of ideas have been floating around. Is like Dr. Watson did the shopping spree, $5 per appointment filled. You count. Ted, y'all have a poster up, and you're really counting on that, right?
Right.
You're counting and measuring, and you can have really a new patient drive in the fall and use your hygiene schedule for that. Really do a big new patient push in October. And also, one thing to look at in your database is who in your database does not have a recare date, some of your reports, you'd be pretty surprised at the percentage of your active patients who don't have a recare date at all. So that's a gold mine. That's your acres of diamonds. Y'all remember Acres of Diamonds story? That's your gold mine right there, where you go into your database and make sure that you know why those patients don't have a recare date. And how do you prevent that is that anytime a new patient comes in, and let's say they come in, I talked to one of your team members about this today. Anytime they come in as a new patient and they didn't go through hygiene, they don't necessarily get a recare date automatically set up in the system. You know, it typically connects to a prophy. And so if they didn't have a prophy, they're not getting that recare date established in your system. So you have to go in and manually enter that. So your new patient coordinator or whoever's in charge of your new patients, making sure you're doing reports monthly, make sure all those patients have a due date. If they came to you as a new patient and said, well, I just had a cleaning, but you guys, I wanted a second opinion, then you'll probably give them a date 6 months out, or 3 months out, or next month. And that's part of their treatment plan. So it just depends on the story for that patient. Is that making sense, what I'm saying? Manually give them a recare date. Dr. Kelly, do y'all do that?
We do. We make sure. I saw a couple today that were second opinions, and we automatically enter that date in because she had just had her teeth cleaned at another office, did not like what they had to say. So
Yeah. Good job.
we automatically put that in.
Awesome.
We actually go ahead and try to schedule them at that point.
Yeah, good. Sometimes they won't, you know, it might be a trust objection, like I'm new here, I'm not sure yet. Or they came in on an emergency and they're not really converted to a complete exam yet. So we just have to do our research. So what other ideas are you coming across to fill your hygiene schedule? Love to hear from you.
We're just not having any trouble filling it. It is
Great. Awesome.
We've hired extra. We are, like someone else said earlier, we're finished with the extra days. We are so tired that, you know, we're back to normal schedule, but we did add an extra hygienist to cover it.
That's all right. That's good. And you got one out on maternity leave.
Yeah, but we have hers covered. The others are covering it. So we've got that. Still have one more admin to hire, but I've been slow to hire purposely because we had to hire so many that we need to train one at a time, I guess.
Dr. Kelly, tell everybody how many team members you've had to hire through all of this.
I have hired 5 new ones.
Wow.
And we have 4 admin typically, and 3 of the 4 all quit within the same week. So yeah, it's been fun. But I will tell you that I feel like we are better. It has been worth the time to hire good people, and I feel like I have my 4th one in the window getting ready to hire her. She's coming Monday for a working interview, but we waited a while just to make sure we were good with what we had. And sometimes patience is good. And I talk to mine, like you were saying, the communication, I talk to mine regularly about, I've not forgotten you. I will hire another one, but let's get our ducks in a row first.
Yeah, that's right. That's great. That's awesome. Wonderful. Thank you for sharing. I know some of the others have had some of these same challenges, so it's good to put our heads together and talk about this. All right.
I was thinking, Paula, too, you know, there's going to be a backlog of patients who are not comfortable coming back yet. I mean, nod your head if you've heard patients don't feel safe coming back yet at this point, if you've heard that. Okay. So I'm counting on those patients to create another surge. They're going to end up with dental emergencies. They're going to end up with problems. There's going to be another surge at some point where all of a sudden, for some reason, they all believe it's all clear. It's probably going to happen around November 4th. They're going to get an all clear sign and they're going to come back in another wave. So be prepared for that with your team to say, all right, I don't want to just, I don't want to just, rush this, again, force people in, or if they come back with emergencies, keep your schedule the way you want it, keep it ideal, but know that, in the back pocket come November, December, that, oh my gosh, my insurance is going to run out. I need to be in there. That's probably that's just a guess. It's a, total, assumption here that I'm making, but there's a good chance those patients will come back once things start to go, oh, it's not as bad as we thought.
Yeah. Yeah, and so we've worked with some of you on some things to do when someone is canceling because they're afraid or they're a little hesitant. Talking to them, there's a few different things of like, if they're insurance minded, like, well, how do you feel about not maximizing your insurance benefits this year? For some people, that might be a ticket. For others, it might be they want to know if you've got people in the reception area or. I love, Eric, what you said. Where else are you going? Are you going to the grocery at all?
Yeah. They're going to the gym to work out, but they're not coming to the dentist.
We're 100% safer than some of those places. So if they'll admit to you that they're going other places, I had this talk with my family members about they have gum disease and they'll go to their other doctor, but they're not going to the dentist. Come on.
And I haven't, and I still, as far as I know, I'm still hearing that there are no cases being reported that have occurred in the dental office. Is that still what they've heard? It's still correct, right? Yeah.
Did y'all get the update that the WHO kind of backtracked? Dr. Watson, tell us about that. Dr. Watson? Do you want to tell us?
Oh, you just muted yourself.
Now I'm unmuted.
Yeah.
Okay. There was some, and in fact, I heard about it today that someone had been to their physician and their physician had heard the report from the WHO that they're recommending that we not do elective procedures again. And so they said, well, are you guys going to close down? And it was actually my hygienist and she said, well, no, we're the safest place there is. And then today they came out, the WHO, they clarified that. They said that's not really what we meant. We meant that if it was a huge outbreak someplace and everything was going crazy, said, but there's no place like that right now. Well, thanks a lot.
That's great information they decided to miss. Conveniently left out.
So that went out in an email today. You should have that in your email about the clarification from WHO.
Right. Yeah, but the word has gotten out a little bit. Mm-hmm.
It has. Ted Morgan, you are writing a great letter or document to tell us about that.
Well, I wrote it yesterday and we sent it out, and we just talked about not believing. I didn't address WHO at all. I didn't mention them at all. I just readdressed the safety issue, in case you're staying home, and what we're doing, we're following all the guidelines and we're going over and above, and talked about ozonated water and fogging with hydrochlorous acid, and talked about it being far less safe to skip your appointment than to come to your appointment. Reference an article that you sent me, Paula. I put the link in about the links to higher risk for all kinds of diseases, and stayed on the positive side and just said, we look forward to seeing you,
Now, and who did you send that to?
All of our patients.
By email?
Yeah, but through RevenueWell.
Mm-hmm.
And I asked Betsy to put it on Facebook. I don't think it got there yet.
I'll check. She can also just send it to me and I'll put it
Oh,
in
there it is.
Yes. Magic. So this is, can y'all see this okay? And the ozonated water is a really big deal. And that Dr. Sutton from the leadership retreat, some of you remember Dr. Sutton, he couldn't join tonight, but he said the generators are back in. Now, Dr. Watson, you got one, and David Johnson, you got an ozone generator, right? Is it up and running now?
Not yet. It's being installed tomorrow.
Okay. All right.
Mine is up and running. I got it all plumbed in, and it's producing water just lickety split. Yeah, we're using it.
Yeah. How much water can you produce with it?
I think it says there's two different flow rates. When you push the button, it's like 0.4 of a gallon a minute. And if you do where you just wave your hand over the sensor, it comes out at 9/10 of a gallon a minute. But it's different concentrations of ozone. Is that right, Ted? Is that what you think?
That's my understanding, but you realize that I'm not in the office much anymore.
Okay.
Other people know more than I do.
Okay.
But ours has been running for a few weeks.
Yeah. I was going to ask David.
Yeah.
So what
Well,
is we looked
I
at the
understand that
machine,
they're
what is
doing
the
a-
cost of it?
Go ahead. Dr. Kelly, say that again.
What is the cost of the machine? We kind of started looking at it, but didn't act on it.
I think it was $3,600 the one I got when I got it.
Yeah.
Thank
Mine
you.
was too. 35 or 3,600.
From TIADS.
And it cost me another 500 to get it installed.
Yeah, I don't know what that bill is, but yeah, I'm sure.
Does that take care of the entire office?
Well, they in my office they fill the bottles on the units with it, and yeah, they're not having any trouble keeping up.
Yeah. Well, one person coming in because of that pays for it. Yeah.
Well, the biggest immediate effect that we saw and anticipation, it quieted down my fearful team members. Before we had it, I said, it's on order, it's going to be here soon, and then we won't have to worry about the aerosol so much because the aerosol will be a disinfectant. And it satisfied all of them. And I think they really feel a lot more comfortable having that in place, plus the fogger,
Yeah, and I've seen team members be more willing to use the Cavitron when we're doing something like that.
Yeah.
So, Dr. Johnson, did you have a question?
Yeah, I did. I'm curious how we're in a pretty low area of infection in our county, but I was curious. I think we're going to see a swell here in the next few days or weeks. How are you handling? This is to everyone. How are you handling potential COVID exposure, like with team members and patients? I know we've had one patient we postponed that we knew was COVID positive, and this may just be that we've been pretty spoiled by being in an area without much exposure. Does anybody have any feel for that?
Good question.
Well, I'll say that we're supposed to treat everybody as if they're a COVID patient, right? And so we have to therefore assume that we have all had exposure. And so the criteria really are no different for team members. If they develop symptoms, then they don't come to work. Which would be different if they
symptoms though.
Yeah, symptoms.
Yeah.
Now, if they test positive and they have symptoms, and there's probably a different set of rules for that, and I'm not the expert on that. We haven't faced it yet. I'll read up on it if it happens.
This is a great link, Cedar Solutions. This is in one of your emails as well. I forget exactly when I sent this out, but it's a great tool where you just click on each one of these and you can go through all of this scenario. The antibodies test, and then there's HR Base Camp on Facebook, right, Eric? That's a great resource.
It's a group on Facebook. Yep.
So there's all kinds of scenarios that you can find here. But yeah,
I would say too, there is a gray area where, you know, let's say I work for Dr. Morgan and my wife gets COVID. She's definitely sick. She has symptoms and she's in my house. I'm exposed to her. You know, that's more of exposure than, you know, I ran across someone at the family reunion. You know, this is 24/7 exposure. You may decide don't come into work, in which case I'm out for those COVID reasons, even though I never have symptoms or anything like that. You may say, give it 10 days or whatever, or until you get symptoms. Yeah, so it's my understanding that they have to be 72 hours symptom free to come back. Is that correct?
If they already had symptoms, Eric,
Yeah.
I don't know.
Yeah, if they either tested positive or they had symptoms in order to come back to work 72 hours symptom free, and somebody was like, that's not very much time. So I was wondering about that.
Right.
So
I've heard
this
two
is
negative
Arkansas.
tests.
Go ahead, Dr. Johnson.
I've heard 2 negative tests.
That could take 2 weeks.
Right. That was one of the hygienists organizations. One of our hygienists relayed that to me.
Typical hygienists.
Well, they're getting out there now with quicker tests. My son had a test yesterday, the saliva test, and he got the results this morning.
Wow.
What state are you in, though?
He was in LA. He was in Los Angeles. And so
Well, there's a factory in Maine that's making those next day tests, right, Mainers?
Abbott Labs, I think. Yeah.
Yeah.
Yeah, they're in Scarborough.
Not the test.
What's that, Dave?
So the Abbott Labs in Scarborough is making the test, that same day test. But we have another one in Guilford, Maine, making the swabs that the president went to.
Well, I have a question about the testing. Who's supposed to get tested? Are we supposed to get tested every now and then, or does anybody know? What's the rule on that?
Exposure or symptoms?
We've never tested anybody, but I'm not worried about people getting it in the office. I'm like you. I'm afraid of people bringing it in. It did happen in an area office here. Someone went to a wedding and contacted it and brought it into the office, and so they had to quarantine.
Yeah, that's the Cedar did that test. What, 22 or 2,300 offices surveyed that said, you know, have you had experiences with COVID coming into your practice? And there were 700 offices reported an instance. So 30% of the time on the survey said, yeah, we've had COVID come through here. And 0% of them reported transference of infection. So it's happening. It's team members, it's patients, and they're getting it at the family reunion. They're getting it at the funeral. That's what I keep hearing. They're getting it at the restaurant, supposedly. They don't really know. And so.
They're getting it from a teenager who went to the beach.
Yeah, college age kid, probably.
Yeah, things like that.
Myrtle Beach.
Myrtle Beach.
I'm going to the beach this weekend. I've been to the beach several times. I hadn't had it.
I bet you do different things when you go to the beach, though.
Well, I promise I hadn't messed around with those college kids.
Good. That's good, Andy. I'm glad you did
It is a good thing. I'm still married.
Got to keep that mask on, you know. Oh my goodness.
It's really hard swimming with the mask on.
Yeah. It's the type of scuba gear, Ted.
Yeah.
So, how's everyone dealing with the schools? I know, Dr. Kelly, now in your county, they're back to school, right? Three of my grandkids live in your county, and they're back to school.
So K-5 is back full-time as of this week.
Right.
Above grades 6 through 12 are 2 days. They could opt out for all virtual, so they had that choice. But I think it is after Labor Day, they'll reassess the upper grades and decide. But our county is a high risk county.
Yeah.
We border Nashville, so we have pretty good numbers.
Right. Thankfully. But so I have one practice. They're a large practice. They have 17 team members who are not coming to work because of the school situation. They're having to stay home with their kids. So anybody else dealing with that?
Yeah, we have some that I have 3 team members.
3?
Yeah. One hygienist, 2 admin.
Yeah.
So did you file for an exemption from the CARES Act?
Not yet, because it's still not clear what's going to happen with them.
I don't think you really have to file for that. You just have to keep on record to prove for 4 years, right? And there is something in the courts about that right now. Eric, you want to talk about that?
It's just really, Dave's right. It is really up in the air, and there's judges ruling, overturning DOJ stuff. It's a lot of craziness, and unfortunately, Congress didn't make a definite call since they broke session. I will say, one of the requirements is I cannot find adequate team members to replace the person out. So like Dave mentioned, I got a hygienist out. Well, as soon as you replace her with a temporary hygienist, you're not exempt. To me, that says I'm not exempt. I replace that person. Now you're paying for them. Now you're paying for 2 people if you're not exempt too. It's a bit of a mess. My hope is that they say, under 50, don't worry about it. You don't have to do anything. That's really our only hope here, and that we need that to be cemented, because right now they're saying that judge that ruled that is focusing on healthcare workers cannot be exempt because there were 900 frontline, COVID workers who died, right? That were on the front lines working. And so they're saying, no, if you need to go and you're on the front lines, you can go and you can be paid. And typically those are over 50 employees. Those are hospitals. So size-wise, we're different than them. So we're hoping that it comes back and they say under 50, you are exempt, but you need to follow these categories. So then the question becomes, well, what if I replace my hygienist with another hygienist? Did I just ruin my exempt status? So
I did pay one of mine last week because she was sick. She had a sinus infection. Doctors won't see you right now.
Yeah.
If they see you, they want to do a COVID test. Well, she had the COVID test and her test was negative, but she still had symptoms. She still had a fever. So with the documentation that she brought me, she was still required to stay home. According to all of our flow charts, she could have had a second test, but by the time she had a second test, the 10 days would have passed. So it wasn't even worth it. So I did go under the CARES Act and pay her the sick leave for those days. Was that the correct thing to do?
It's your call. I mean, just make sure you classify it on your payroll so that you get reimbursed to the federal government. So you won't actually end up paying it. You'll get reimbursed in the end. But just make sure you don't miss that part. It's just your call. And look, it depends on what state you're in. If you're in California, I'm like, look, if you're at all wondering and you don't want to have an employee sue you, then I'd say pay it. It's up to 10 days. They work 2 days a week for you. You pay them 4. So it's up to $511 a day or their normal pay. And you're going to get the money back. So if you're all worried that it could come back to bite you, then pay them. But if you're like, this doesn't make any sense, in my state for my employees, this is definitely a black and white issue, then I would fall under we're exempt, because right now you are. So you can preach that for now, but that could also change.
And the way I understand it, Tennessee, I'm kind of lucky to be here. I think the governor just passed a thing, we can't be sued.
Oh, good.
Yes.
With the CARES Act, if they stay home for childcare, isn't it? It's like 2/3 you have to pay.
2/3.
It's up to $200 a day, and that's a 12-week. They can be gone for 12 weeks, but the first 2 weeks is no pay. The last 10 weeks you pay up to $200 a day.
Yeah, right. So I have to acknowledge Dr. Kevin Devine. Dr. Kevin, tell us what you've been doing. What are you doing mostly during the day with patients lately?
Well, it's some days because of COVID and to make ends meet, I had to take a second career. I became a dental hygienist, and usually I have been working averaging about 12 days a month, and now I'm adding a couple days a week to do hygiene, or I was. Today was my last day, so I had a little retirement celebration from hygiene today.
He got his 2-week pin.
And
Way to clean up.
I had a pretty high regard for hygienists because I'm married to one, but I've got an even higher respect for hygienists now. I never want to do that again.
Kevin was amazing in that he volunteered to do hygiene, and work additional days because we didn't have a hygienist. It was awful. Again, we just had our hygienist get licensed today.
Oh, came through! Yay!
Awesome. Hannah did. Yes, we pushed the board hard, and she got her license. So,
wonderful.
But it's been quite a time, and Kevin has been amazing during that time to come in and do hygiene. And the best thing, I wanted to keep him forever. I was hoping Hannah wouldn't get licensed because I could do work all day long, and I didn't have to do any exams.
Yeah.
It was amazing, not to do a hygiene exam. It was great. I got to have lunch with Kevin, and I didn't have to do any hygiene exams. It was pretty nice.
That's awesome.
That's great. That's really good. All right.
I don't know that the patients thought it was all that great, but hopefully they'll give me a bye.
I just think that was very willing wit of you. Some of you know what willing wit is. Y'all remember willing wit? Whatever it takes. So I just want to acknowledge you, Kevin, for what you've done there in the practice. It's really been helpful. So I know we've just got a couple minutes left. Is there another question that you have for the group that we haven't covered? It's really exciting to be with everybody and see how well you're doing. I mean, pretty much everyone in this group is doing really well. And very, very excited about that.
Paula?
Yeah.
I just wanted to say how much I appreciate the input everybody has in this group. We're all, it seems like everybody's a very select person that really has the pulse of what's going on. And, there's a lot of mystery going on out there and a lot of stuff on the social media. Yes. But I think everybody here is really down to earth and has a plan, and they're executing it. And nobody is working in fear or panic. We're just moving right ahead. I know in my own practice that keeping in communication with my team throughout the closure, and then communicating with them every day, and being calm myself through everything really is, I think, giving them all a feeling that we're in control, and they're not worried or concerned or panicked. And they've had a very positive mental attitude. And,
that's right. PMA.
Everybody here is of the same mind, and I really appreciate this group.
Thank you so much for saying that. And just to tell a little of your story, you had all new team right before this happened, right?
Right before all this took place, brand new team.
Yeah. So that was like, whoops, hurry up, stop. Yeah.
We had a lot of Zoom call communication with our team throughout the closure to keep everybody connected. And
Eric and Paula Soster.
Yeah, and Eric and Paula both were a huge help keeping everybody, in knowledge and on pace, and everybody was connected, and
y'all have done a great job. You really did a great job through the whole thing. So
they're not on anymore, but Dr. Slava and Ehab were on here earlier, and they had an assistant come in. She's been in a different field for a few years. They were going to tell a story, but I'll share it, where she was in, I think it was yesterday, and around 12 o'clock, she literally ran out of the office. No word to anybody, just ran out. That was it. She panicked and left. Just couldn't do it.
Oh,
Yeah,
wow.
she hadn't been in dentistry in 3 years and thought she can come back and do it. And I think she just got terrified. I don't know, COVID scared her away or EHOB did. I'm not sure which, but
Wow.
we were laughing. I mean, I feel bad for her, but we were laughing. It's like some people, I guess, aren't ready.
Yeah, seriously, I know. Well, Eric, let's tell a little bit in closing here. We won't spend too much time on a commercial, but if you could bear with us for a second, you've probably seen in your emails, we're going to do a dental Zoom camp.
That's catchy, Paula.
Eric, tell us about it, Eric. What are we gonna do?
I know we're gonna have fun. That's for sure. We're gonna do a 2-day, 7-hour each day, just a virtual retreat, and we're gonna be on Zoom just like this, just like we did a few months ago with leadership. But it's gonna be a whole team, and we're gonna work on everything from team building to verbal skills to systems to case acceptance to talk about Denvantage, recession proofing your practice.
Mm-hmm.
And Paul and I will even do some role playing for you. So
yeah,
good. Yeah.
And if you can't,
I get to be the patient though, Paula. I'm saying it now. I called it. That's like calling shotgun.
Not fair.
Bobby, Ricky Bobby.
Ricky Bobby. Yep.
Joey Buttafuoco. He gonna be there. How you doing? Yeah. Me and Kevin will work on our camel selling business too. That was always a good idea.
Humping the please.
Yeah. It's gonna be fun. It's gonna be fun for sure. But if you have team members who are back in, who haven't been through that 2-day course that you guys are so connected to, this is the chance to get them caught up, get them on the same pages. You can attend as a whole team. You can just have them attend one-on-one, but get them up to speed and on the same page and know what you mean when you say, over here psychology. What does that mean? So.
Right, Paula, sign me up.
All right, absolutely.
How you doing?
How you doing? And if we can't do that, we have the recordings, the videos. Eric and I have done the videos. We have 12 at least, probably 13. Some of you already have those in your collection. You get to keep those. We send them to you as a Google Drive document. And so let us know how we can help you keep your team up to speed. I know verbal skills are just huge right now, huge.
Yeah.
So we want to be there for you. All right. So,
all right, and I'll say one more thing, Paula. Maybe it's one more. It could be more.
Virtual on-site. We didn't talk about that, but.
Oh yeah, so you can have that done in a 1 day, however you want, virtually too. We can do that by Zoom. 4 to 6 hour meetings. I'm doing
just
one
for
on
your
Monday.
Team. Yeah.
Yeah, just for your team. If those dates don't work for you, we can do it however you like. So I will say this: please do me a favor, guys. Market your practice with one word right now: safety. Just market it that way. Whether it's asking for referrals, asking people to do reviews for you, have them include the word safety. And then on your social media, for those of you I'm helping with your social media, we're talking about smiles and safety, smiles and safety, smiles and safety. And so keep doing that. You need to be the one that toots your own horn. Nobody's going to promote you more than you're promoting you. So if you can get your patients to do that for you on Google reviews or Facebook reviews, do that. And then get your team to then share those on their Facebook page and spread that word of safety. We just need to get the word out.
That's good. That's awesome. All right. Anybody else have anything they want to say before we close? Any questions or support you need? Was this helpful?
Yes.
Yeah.
Thank you.
Very good.
Dr. Towers?
Thank you so much, Paula and Eric and everyone else. I really got a lot out of it, as always. Thank you.
Good. Thank you. It's good to be together. All right. See y'all soon.
Thank you. Bye.
Bye.
Bye, guys.
Right.
Oh, one